Good morning, everyone, and welcome to episode 265 of the On Air Advocate. Where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate. And I am super excited if you are joining us here this morning, or if where you are, it's afternoon, or if you're catching this on the replay. Now, as always, if you think any of the content that we are talking about today could be relevant for anyone in your network or your circle, please hit the share button and share the love with others. Well, if you guys have been following us on social media, you guys know that this is our Spotlight Week. And we are so excited to have this organization kicking off our Spotlight Week as we are learning all about Sarcoidosis Awareness Month here at the On Air Advocate. And to start that out, I have some of the people over here from the Foundation for Sarcoidosis Research. And so we're going to start that off with Mary. Welcome.
Well, thank you so much. And thank you so much for spotlighting Sarcoidosis Awareness Month of April. It's an honor to be here with you today. My name is Mary McGowan. I'm the CEO of the Foundation for Sarcoidosis Research. I joined FSR, as we are known also, and call ourselves, as the first CEO in September of last year. It's an honor to be part of this extraordinary organization doing such important work for sarcoidosis patients and care partners and family members and clinicians. So it's an honor to be here. I came to the organization with about 35 to 40 years of management experience. I was CEO of Women Heart, the National Coalition for Women with Heart Disease and Cardiovascular Space. Was CEO of the Allergy and Asthma Network in the respiratory space, was with the American Academy of Pediatrics for 18 years, speaking up for children. So it's an honor to be here, and it's more of an honor than even to be with Dr. Elliott Crouser, who is our esteemed Scientific Advisory Board Chair. And I will turn it over to Dr. Crouser to introduce yourself.
Well, thanks, Mary. Yeah, it's a privilege for me to be the Scientific Advisory Board Chair for the FSR, Foundation for Sarcoidosis. I'm going to call it FSR from here on out. I don't slow things down. I've been involved in the care of sarcoidosis patients for over 25 years and created a specialized clinic for them. It actually is a multidisciplinary clinic. I can't do all the things they need, so they're very complicated patients. I've done research for years, and actually one of my first grants was from the Foundation for Sarcoidosis, FSR. I continue to do research in collaboration with the Foundation and with others the FSR is working with a network of other research entities to push the field forward. And we're going to talk about that a little bit more today. Yeah, and I am also was recently the lead of the first ever American Thoracic Society clinical practice guidelines. So I think we're going to discuss some of that today.
Wow. Well, it is an honor to have both of you here today. And myself, this year, I've really wanted to make a big impact as we look at things that are more rare conditions or conditions that a lot of people don't know much about. And so I definitely want to take a dive into this. I know you guys were referring to sarcoidosis as also STARC, right? STARC is another word that we can use for that to shorten that up a tiny bit. Dr. Crouser, can you kind of take us away with what is this condition?
Well, first of all, sarcoidosis is considered a rare lung disease, but it's actually one of the more common interstitial lung diseases we see in my clinic, for instance, or pulmonologists would see across the country, across the world. Interstitial lung disease is a disease that affects the interstitium of the lungs as opposed to the airway or other parts of the lung. It causes the lungs to become scarred and inflamed such that air and oxygen and other gases can't get into the lungs or in or out, and it causes shortness of breath and other symptoms. But sarcoidosis is interesting in that although it most commonly involves the lungs, it also involves the lymph nodes, and it can be confused for a cancer, for instance, and it can involve just about any tissue, organ in the body. And in those cases, it's a very severe condition for those patients. So it's not just a lung disease, it's a systemic disease.
Okay, and does this have any genetic links to it?
Oh yeah, certainly there are genetic links to it. But unlike some other genetically driven diseases, it's not one gene. It's an array of multiple genes that are typically, or one or another gene can be affecting this person or that person or different populations of people. So it's what we call a complex genetic disease.
Okay. And when we talk about signs and symptoms, are there pre-symptoms, that actually drive people in to see their physician to actually find out that they have this condition?
Well, that's a great question. One of the most common manifestations of sarcoidosis or complications of the disease are that it's the failure to recognize it early. It can take several different doctors before you get the right diagnosis because it's very nonspecific. Typically, people will present with just fatigue or night sweats or weight loss or very nonspecific symptoms. They may also present with shortness of breath, coughing if the lungs are involved, and depending on what other tissues are involved, like the skin, they can have a rash. They may have eye involvement with vision changes. So it's interesting. A cardiologist might be the first one to see a patient because they're having chest pains and palpitations.
Yeah, they're having all these different symptoms that could actually be some other condition. So they might be driven around to different doctors before you actually get to actually get to know that it is that condition. How, is there a certain testing that is done that lets you know that this is actually what you have?
Well, according to those guidelines I referred to earlier, there are actually three pillars of making the diagnosis. One is it should be a compatible clinical presentation. In other words, the typical finding would be radiographically, they would have lung involvement, lymph node enlargement, or various skin manifestations, et cetera. So the clinician would look at them and say, yeah, I think this could be sarcoidosis. Of course, it could be other things too. Then the next step is to actually procure some tissue, send it to the laboratory, and look for the characteristic inflammatory findings, which are called granulomas. These are actually a constellation, almost like a ball of inflamed, inflammatory cells that congregate usually around a single, some kind of antigen or environmental insult that is confronted by the immune system. So they encircle this. For instance, the same kind of granulomas might be formed in a tuberculosis or fungal infection, that kind of thing. So the last thing, you have to exclude these other things. You have to look for tuberculosis, fungal infections, or other causes and exclude them before you can finally say that's sarcoidosis.
And do we know how many people in the United States or in the world actually have this condition?
Well, that's a really good question. I wish that there was better tracking of this. There are a few countries that track this very closely, but the United States is not one of them. The CDC does not track the number of cases. And in places where they've actually done a very careful analysis of this, for instance, in the Boston area among African-American women, the prevalence was very high, like 2% of African-American women had sarcoidosis in that cohort. It was a very large 55,000 person cohort. It was followed for over 10 years. And that's a lot more prevalent than we thought it was. So it may be more common than we think. And there's probably regional prevalence, like maybe it's more common in Boston than it is in Phoenix, et cetera.
Right. And we don't know why that is.
We don't know exactly why that is.
Okay. And then where is research at right now on that to kind of detect, those things and kind of pick this apart a little more?
Well, I think we are interested in understanding why it affects some populations more than others. Mm-hmm. Why is it more severe in African-American women, for instance, than it is in other non-African-American populations? And we're also starting to see that, back to your first question about the prevalence worldwide, we're starting to see in Asia and Africa, as their health systems are maturing, they're now able to separate tuberculosis from sarcoidosis. They're seeing a lot more cases now. So it's the worldwide prevalence is still something we're learning about. And the reason that some people have a more severe kind of phenotype of sarcoidosis compared to those that never need treatment and are asymptomatic, that is a very interesting area of research right now.
Okay. And So on that of therapy, treatments, whatnot, when someone is diagnosed with this, what are the different therapies and treatments, and what can they do about it?
Well, we don't like the available treatments very much. The recent expert opinion was all the experts around the world were asked, well, what do you recommend as the first line therapy? Well, we all felt like it would be best not to treat them with any pills. If you could get away with a topical therapy for a skin rash, or eye drops for the eyes, or inhaled therapy for the lungs, that would be best. But many people just can't get away with those kind of treatments. They need more. So if their disease is progressing and it's in vital organs, we often treat them with corticosteroids, or we call them steroids, but those are steroids that are not the kind that make you bulked up and strong, but the kind of melt you down and make you flabby and have all kinds of other complications. So they work very well, but they have all these side effects. So we actually have steroid sparing agents for people that need ongoing treatment. So those might be methotrexate or azathioprine or other medications that would reduce the need for the steroids. And then at lower doses, these other medicines are pretty well tolerated, but they're more expensive. They need more monitoring, and there's some side effects from those too. And then the last line, if they're really sick, these other things aren't working. Well, the anti-TNF therapies are infusion therapies or injection therapies that are the third line treatment at this point. And then I won't get into novel, other therapies that are on the horizon just yet, but we're trying to develop better ones, obviously. And that's really one of the themes of FSR.
Yes. And kind of in that wrap up, for the quality of life for someone who has this condition, and also the age range. I know we didn't touch on that. What age range do you usually find this in people? Something they're born with, or that usually find later in life? And what is that quality of life going forward once you're diagnosed?
Yeah, other lung diseases might hit you later in life, like COPD and pulmonary fibrosis. These kind of are older age groups. But sarcoidosis more often affects a younger middle-aged person, like 30 to 50-year-old demographic. That's when the average age of a patient in my clinic is 47. So they're young, and they get this disease for years. So it affects their ability to work, to be a parent, it hits them in the prime of their life. It may not often cause death, but it's got a huge impact on the quality of life, and the effects on the family, et cetera, can be dramatic. So I think that's why that draws a lot of us into this field, is like, boy, I didn't know this was such a thing, we ought to, as a physician, I see this every day. So I have a great appreciation for how the quality of life issues that relate to having chronic pain or chronic fatigue or shortness of breath, et cetera.
Right, right. And so I love this for me to lead into chatting here with Mary. Thank you so much, Dr. Crouser. Really to learn more about the Foundation for Sarcoidosis Research and all the amazing things that, you guys do and you provide. And so can you kind of take us through that?
Yes, so the Foundation for Sarcoidosis Research was established in the year 2000. So we just celebrated our 20-year anniversary last year. And we are the leading international sarcoidosis organization working to find a cure and to support patients and care partners in their journey living with sarcoidosis and dealing with sarcoidosis. So there are several pillars to what we do at the organization. We accelerate research, and we do that by providing research funding and the many other efforts that Dr. Crouser was talking about. We advocate for patients on Capitol Hill, advocating for policies that meet the needs of those living with sarcoidosis, and also for additional research funding through NIH and other pharmaceutical companies and other ways of accelerating advocacy and research efforts. we support patients. We have a number of support groups across the world. We have a number of support programs that help bring together those living with sarcoidosis and support them in their journey. And then, of course, we have a number of education programs. We have educational webinars. We do educational conferences and summits, both for patients as well as also working to educate clinicians. Again, with sarcoidosis being a rare disease, we want to make sure that sarcoidosis is staying at the forefront of those who are working to provide accurate diagnoses for patients.
And Mary, I know Dr. Crouser, we didn't chat about this, but so does sarcoidosis, that falls under the rare disease category? That does fall under rare disease?
Yes, just barely.
Okay, I know there's that cutoff, right?
The cutoff in the United States is 200,000 per year, or at any given time, 200,000 cases, and it's right just below that number by some estimates.
Okay, thank you so much. Now, Mary, with the organization, I know that sometimes, especially when we talk about things that are in the rare disease category, there isn't always that insurance funding, and families have a hard time getting treatment and stuff like that. Does the foundation do anything that way, helping to get people to the right doctors, whether that be through transport or other funding services, that when people are making donations, some of that supplies towards?
Yes, we do help patients get to the right doctors. We have information on our website about that, and we also, through our Patient Navigator program, which is a one-on-one support program where we connect together sarcoidosis patients. Through that program, they can also learn about clinicians that we have been working with who are treating patients living with sarcoidosis. So there are those opportunities. With regards to insurance, we definitely want to and continue to help patients navigate the insurance journey with getting coverage for their medicines and their therapies that they need in their treatments for sarcoidosis. So that is an effort that we are very much involved with and work with patients on.
Wonderful. And you were talking about the support groups and those things that you offer. So are there separate support groups for the caregiver, the individual that is going through treatment, that has the condition, family members? I know that sometimes different organizations have conferences too that the whole family can come to. So support-wise, can you break that down just a little farther for me?
Sure. Yeah, we're very interested in supporting everybody in the sarcoidosis community. So that includes, of course, sarcoidosis patients, but also their care partners who are playing a very big role in supporting them as well. So we want to support the caregivers as well as family members. So anybody who's interested in receiving support, receiving education, being involved in our community, whether you're connected with sarcoidosis or not. Again, getting back to Sarcoidosis Awareness Month, we're looking forward to people really engaging with us. And on our website, we have a whole webpage on Sarcoidosis Awareness Month and how people can get involved and put a Facebook frame around their photo for the month. Engage in our social media programs. We have created social media graphics. So we're really looking for everybody at large to engage with us to help raise awareness, because you never know, your family member might be the next person to be diagnosed with sarcoidosis, or a coworker or a family member. And what we're trying to do is to shorten the gap of getting accurate diagnosis, which can be problematic for rare diseases. On average, it takes 6-7 years for an accurate diagnosis. So how can we shorten that gap? And we can do that through education and awareness.
Yes, I love that. And so you're talking about the Awareness Month, all the things that you're doing. I know you guys have an awesome Facebook. On your Facebook too, you have tons of information. But on the site, what if somebody wanted to become a volunteer?
Yeah.
How do we do that? Is that something that they put an inquiry in, or if they want to know more of the positions that are open in being a volunteer? How does that work?
Yes, absolutely. There are a lot of volunteer opportunities that are on our website. Again, if you're living with sarcoidosis, you can attend our trainings to become a volunteer navigator so that you can then take your learnings and help others that are living with sarcoidosis, particularly those who are newly diagnosed, right, who really need a lot of support in trying to navigate the beginning of this journey. So there's definitely ways, there are ways to get trained to run a support group. It's really a terrific opportunity to support others in your local community or to become a spokesperson. We do a lot of communications trainings for people who want to share their story, whether that's a care partner, a family member, or a person living with sarcoidosis, again, to help us raise awareness in local communities. And then, of course, through our events. Right now, again, with Sarcoidosis Awareness Month, we're doing Steps for Sarc. And this is a great opportunity for individuals to get together a little team and to go out walking and get some exercise and have that count towards fundraising so that sarcoidosis research can continue along on our efforts to work towards finding a cure.
I love that. And with that being said, so this month there is the walk. Getting involved in that, is that all month long?
Yes, it is.
I went on there, I could sign up and I just track how many steps I take.
Yes.
And is there other webinars or any other broadcasts that are special coming up this month that you would like to let the folks know about?
Yes, absolutely. So we have a Monday memorial service. It's the last Monday of the month. And this is a candlelight vigil that we're doing in the evening. And this is to celebrate the lives of those who have lost their lives to sarcoidosis, to celebrate their lives and to bring memorial to them and to their families in that effort. It's a wonderful program. We connected, partnered with a candle company who created a Celebrate Life candle specifically for FSR, and proceeds for the purchase of those candles go back to support research at FSR. So we're very excited about that. We also have a nutrition educational webinar coming up in April, and this is really important for people to understand the diets and nutrition that are really effective for sarcoidosis patients. So we encourage people to engage in that. And then we're running a series of wellness programs. Again, through this time period of COVID, where a lot of people are feeling isolated, particularly those who are at even higher risk for COVID, we have been really concentrating on psychosocial support and mindfulness training and sessions to bring patients together during this time period. So those are also offered in April.
Wonderful. So all of those different things that you mentioned, we are going to drop those below after this segment. So if you were listening and you didn't have a pen in your hand, just know that they will be below and above in the text as well. With that, anything in closing, you guys, that you want anyone to know about this condition, something to remember?
Well, one thing I want people to know is to please join our community. Our website is stopsarcoidosis.org. There's an opportunity to join the community. Again, this is for anybody living with sarcoidosis, knows someone with sarcoidosis, or just wants to be engaged in this international effort to help raise awareness about this rare disease. And by joining the community, then you get to stay engaged with us, and you get to receive our electronic newsletters, and you get invited to all of our events. And it's just a wonderful way to expand on today's podcast and the lively discussion that we've been having here today.
Well, thank you so much, Mary. Anything in closing, Dr. Elliott?
Yes, I would just like to thank Mary for having done such a great job of pushing this field forward. And the FSR is really the great resource for all of us who are physicians and researchers to get engaged ourselves. And that's honestly, that's why I'm here, and this is why I'm doing this. Mary recruited me to this position because I intend to apply myself to the betterment of these patients. And I'll mention one other thing. When we have our science meetings, there's always an FSR patient engagement meeting right alongside, and the docs and the patients get together, and that's a really good forum as well. So I hope the doctors and the patients will all kind of come together through the FSR's leadership.
Well, I thank you both very much for sharing here at the On Air Advocate with us this morning. And for the whole entire month of April, we are going to continue drawing and driving awareness for sarcoidosis as well. So thank you guys so much for being here.
Thank you for the opportunity. It was our pleasure.
Thank you.
Yes, thanks. And if you guys would like to know any more about the On Air Advocate, you can head on over to onairadvocate.com and find out all about our services right there. Or if you are viewing this on Facebook, head up to the top of this Facebook page, hit the blue button, and that will let you into our private community. So with that, I hope you all have a very blessed and wonderful Wednesday. And I thank you guys so much for being here today. Thanks again. Bye-bye.
Bye-bye.